If you are 55 plus and experience lower back pain, you are not alone in this video. I'm going to show you the 5 best exercises that I recommend to all my patients over the age of 55 who experience back pain themselves. Now, the exercises I'm about to show you are going to range from beginner level stretching and mobility exercises to advanced level exercises that focus on strengthening the muscles around our core, our hips and our legs. At the end of the video, I'm going to show you one bonus exercise that I would argue that all individuals over the age of 55 absolutely need to do in order to build strength, but also remain in shape. Hi, everyone, my name is Daniel Thompson. I'm an advanced physiotherapist specializing in low back pain. And in this channel, I bring you the best tips and tricks, the simplest stretches and exercises to help you take control of your own back pain. Okay, so let's start with the first exercise, and this one is called knees to chest, and I'm going to give it a green circle to notify that it's an easy stretching exercise. Okay, so let's get started. I'm going to ask you to go onto your back for this one. You can be on a bed, a mat, or the floor from here. You're going to take your knee up towards your chest. You can do it single or double. I'll show you the first one first. Hold your hands behind your knees and pull it up towards your chest, just like this, nice, gentle, and build the stretch in your lower back. You can repeat that on the other side, and for this one, you would do it 5 times, holding for 10 seconds. You can also do it double, like I mentioned, just like this. If this is difficult on your knees, you can put your hands behind your knees. Remember to breathe. Remember to keep your head supported and your back supported. You should feel a gentle stretch in your lower back again, holding for 10 seconds, 5 times. This exercise is great to open up the joints and the muscles in your lower back, which can help with pain relief. Exercise number 2 is called sitting lumbar flexion, and I'll give this in a green circle as well, because it is an easy stretching exercise. The way this works is you sit on a chair just like this, separating the feet out a little bit, allowing your body to move forward. And what you're going to do is place your hands either on your thighs and slowly start to slide them down like this as you bend forward. That's one variation. You should feel a nice stretch in your lower back. You may even feel a stretch in your hips, which is also good variation. Number 2 of this one is putting your hands right in between legs. Same thing, sliding down as you lean forward, going as far as you feel comfortable. Bring your hands, if it feels like you can bring it to the floor. If not, you can stop at your shins, at your knees, whatever is right for you. And what you would do essentially is you would hold that end position wherever it is for 5 seconds, repeating it 10 times, all right? So just like this, holding for 1, 2, 3, 4, 5, and each time you go down, you want to try to go just a tiny bit further, allowing the joints and those muscles to sort of open up a little bit further. So that's exercise number 2. Exercise number 3 is called the seated crunch, a very effective and easy to do exercise for many adults. And this one is going to be a yellow circle for me because it is an easy strengthening exercise. So on your chair, just like this. And what you're going to do is you're going to be at the edge of the chair. Feet are going to be in line with your shoulders and your knees. You're going to cross your arms in front of you just like this. And what you're going to do from here is rather than just allowing your body to bend forward like the previous exercise, you're going to squeeze the muscles of your belly or your tummy or your core, tighten those, and then sort of allow those muscles to bring your chest forward. It's almost like doing a crunch or a sit-up in a lying down position, but you're doing this from a sitting position. So tighten, bring forward. That's 1, 2, 3, continuing to breathe as you go, and you would repeat this 10 times for 2 sets. So that's exercise number 3. So exercise number 4 is an easy strengthening exercise. I'll give it a yellow circle for that. This one is called core activation with leg lifts. So on your back, just like this, you want to get comfortable. And this works in 2 steps. So step number 1, you're going to tighten the muscles of the front in here, your belly, your tummy, your core, whatever you want to call it. Imagine drawing in your belly button towards the bed or the floor, tightening just a little bit just to get the core going. And then from here, while you hold that step number 1, you're going to lift your knee up into the air, which is step 2. Bring it back down and then repeating on the other side just like this. So remember, this is different from the knees to chest, where you're using your hands to bring it up towards your chest here. You're actually asking the muscles of your core to work in order to lift the leg up just like this. And remembering that as I'm doing this, I'm breathing, but I'm also maintaining the core to be tight and strong. So you would repeat this 10 times, starting with maybe 2 sets, and then going up to 3 sets if that feels comfortable. And by 10 times, I mean 1, 2, 3, 4, up to 10. So 5 on each leg. And this is a great segue into the 5th exercise, which is called the dead bug, which is one of my favorite exercise X's for strengthening your core and also improving your lower back pain. So same thing as the exercise number 4. Step 1 is the same core is tight, core is strong. Drawing your belly button down from here, you're going to get into the position of essentially a bug that is dead. What you're going to do is lift one knee up, lift the other knee up to match it. And if it feels comfortable for you, you can bring your hands up into the air like this. And essentially, you're holding this position starting from maybe 10 seconds and working your way up. And 2 key points here. Remember, core is tight, but that, also continuing to breathe. We don't want to stop breathing of applause course and then bring it back down. You can bring it one leg down at a time, hands down at a time, and you would repeat this 3 times. Hold on, breathing, 2, 4, 5, 6, 7, 8, 9, 10, and then I'm bringing it down just like that. And the best part about the dead bug is that there's many variations to it. You can do it with just the legs. You can do it with one leg, one arm. You can do it with just arms, if that feels comfortable. And then the main one is both hands and legs up into the air. And even from here, if you want to make it harder, you can move one arm down at a time. You can drop one heel down at a time. You can even straighten one leg out at a time. And this is much more difficult. However, I would say for most people, the main foundation one is where you're lying on your back, hands up in the air, knees up into the air. So there you have it. That is the dead bug, all right. Now I'm going to show you the bonus exercise that I had mentioned earlier. This is an absolute game changer for all adults over the age of 55 in order to remain in shape, to remain fit and strengthen the core and the legs. You're going to use a chair for this one. This exercise is called a sit to stand or a chair squat. 2 variations, one is easier, one is a little bit harder. Generally, I'll give this a yellow circle because it is a fairly easy strengthening exercise, especially if you listen to your body and do what's comfortable for you. So you can use the seat to push off. You can use armrests if you have them. Essentially what you're doing is you're pretty much going from a standing position to a sitting down position, but you're going to do it slowly, using the muscles of your legs and your core. So the first variation is called the sit to stand. I'm going to use the seat to sort of push off. Your feet are going to be kind of behind the level of the knees. You're going to be at the edge of the chair for this one. And how you initiate this is by leaning forward. Use the muscles of your legs as much as you can, but if you need help from your hands, you can do so, of course. So from here, you're just standing up, and then when you're going back down, you're going to, again, find the seat and then slowly lower yourself down. So you don't want to just sit back down or plop down because that's not using any of the muscles. We're using this exercise or this movement intentionally to work on these. So I'll show you again. Come to the edge feet, slide back a little bit, hands on the seat or the armrest leaning forward, pushing up, and then slowly sitting back down, and you would repeat this 10 times for maybe 2 sets or 3 sets or until you start to feel these muscles working really, really hard. The second variation to this exercise is called a chair squat, same movement, but without using your hands. So you can do it this way where your arms are crossed in front of you, or you can have them out in front just like this. So I'm going to do it with my arms crossed, and you're doing the same exact thing, leaning forward and pushing up, leaning forward, and then slowly lowering down and right back up. Sometimes I suggest my patients to just touch the chair and go back up if you're able to do that. And I already feel the burn in my legs from that one same thing, repeating that 10 times, 2 to 3 sets. And the reason why I love these 2 exercises is that they work on some of the biggest muscles in our bodies, including our core legs, muscles of our calves, your ankles as well. And it's really allowing you and improving your ability to get up from a chair, which we do all the time. It also helps with stairs, helps with walking, and so many other things that we want to do in our daily lives. I'm already out of breath, but you can do maybe starting with 1 set and then working your way up from there. So that's the bonus exercise that I think everyone should be doing, especially if you are over the age of 55. So there you have it. Those are the top 5 exercises for people over the age of 55 who experience lower back pain. If this video has been useful to you in any way, I'd love to hear from you in the comments section below. Until the next video, I'm wishing you the best of health.